Welcome to our 5 on 5. We're pleased to be joined by Jennifer Lind, a regional executive with Jackson Care Connect. Jennifer, good to see you. How are you today?
Hi, I'm well, thanks.
Very good. So tell us, what is a coordinated care organization, and how did that concept kind of get started?
Well, coordinated care organizations are really the front point around the nation of some of the health reform efforts that are taking place. Our Governor Kitzhaber went to the federal government and asked for a $1.6 billion grant in order to take on some reform efforts and also to expand the Oregon Health Plan here in Oregon. And so CCOs are really the ability to take what used to be a state-managed benefit under OHP and now make it locally controlled. And we have 16 CCOs around the state. Jackson Care Connect is one of those, and we cover just Jackson County and have about 25,000 members here in Jackson County. Okay,
so if anybody's watching at home thinking that maybe they should be hearing from you or maybe they should be contacting you, is that process already begun? And if so, you would have already been in touch with them?
Yes, in many ways. So the first point is the effort to expand Oregon Health Plan here really has gone exceedingly well, and we have signed up in the state several tens of thousands of people. I think it's around 70,000, and is not related to all the challenges people hear around with the Cover Oregon website.
Right,
so this is a very different ballgame. A lot of people already got letters saying you are presumed eligible. We have about 15,000 people in this county who are presumed to be eligible now for Oregon Health Plan who were not eligible before. And so those letters have been turned in, and we have been signing quite a few people up. There's two changes that happened on January 1st that are really important for Oregon Health Plan. The first is many more people now are eligible. It goes up to 138% of the federal poverty level. And what that really means is for a family of two, around $21,000 annual income, and that's higher than it used to be. So you can check on the website at Oregon Health Authority to get more information on that. And then the second change that happened is the actual benefit has expanded. So it used to be that you only got some benefits if you were a certain population. So for example, pregnant women or young children would get preventative dental services. Everyone else got emergency dental services. And that's now changed, and everyone who is on the plan gets what used to be called the OHP Plus benefit package, which means everyone now gets dental benefits. We, the CCOs, we, Jackson Care Connect, are providing those dental services through all of the major dental plans that existed before. And so it's a much more robust package of health services that we're able to access now.
Very good. Glad to hear it. All right, we're going to take a quick break. Much more in our 5 on 5 in a moment. Stay with us.
Great.
Welcome back to our 5 on 5. Again, we're here with Jennifer Lind from Jackson Care Connect. So Jennifer, what is Jackson Care Connect doing to improve health in our community?
So we've been asked by the state to really focus on three primary issues. The first is to improve the experience of care that we have when we go to the doctor. The second is to make sure that it's a low cost, and so we're really asking to reduce our costs. And then the last one is to have really high quality health outcomes. So as you can tell, these are going to be tricky things to do, and we at Jackson Care Connect acknowledge the only way we'll ever achieve that is really through partnerships with all of the high quality organizations we have in our county already delivering services. So we've started quite a few projects, and they're really pretty exciting and starting to show some great results. We had some initial funding from Care Oregon, who is a partner of Jackson Care Connect in this work, and now some extra funding has come through the legislature for the CCO effort as well. So we're starting to do things like really help patients and individuals manage their health better so they're not having to rely on emergency rooms or emergency departments. This involves putting community health workers in some of our clinics, and they're working one-on-one with patients who have complex needs, helping them get the types of services they need. It means we're having emergency department guides. We have one right now with Providence Hospital here locally, who is helping patients link up to the types of services they need and getting them set up with doctors who will manage their care in a more comprehensive fashion. We're helping to support some of the health information technology, which makes sure that doctors and hospitals can communicate with each other rather than us individually as patients having to take all of our information back and forth. And then we're really seeing a need to improve mental health services, and so have been working with Jackson County Mental Health to plan about how to improve those sorts of services for children in particular.
Oh, very good.
We're right now finishing up a community health assessment, and then we'll base some work over the next year or so defining some strategies that we want to take out of that for our health improvement plan. Wow. So it's really a lot of exciting work that is showing a reduction in costs right now.
Already, very good.
Already, the state itself has shown that as a whole, and Jackson Care Connect has as well. And then maintaining our high quality of patient care that we really believe is delivered. One of the other ways that we're doing that is really focusing on medical homes. So the idea is that when you go to a doctor, you're really having an array of services that are there for you and are reaching out to meet all of the needs that you have. And this is based out of the fact that we realize only about 10% of our health is determined by medical care. And about 90% happens outside of the doctor's offices. So things like the type of schools that your kids are in, if you feel safe in your neighborhood, if you have a job, if you have housing, if you have adequate food. And these are the sorts of areas that Jackson Care Connect is now interested in exploring and seeing how can we support those other areas in our lives that really determine the type of health we have as individuals.
Very nice. Well, thank you for coming and sharing with our viewers all this work you guys are doing. I appreciate it.
It's wonderful.
Great to meet you.
Thanks so much. I
Thanks,
appreciate
Jennifer.
it.
Our pleasure. Stay with us. We'll be right back.